Till that time, we'll get started. Good evening once again, my dear students, all over the world. Today, we'll continue with our CVS cardiovascular system. Another yet important topic that we're going to discuss today is your atherosclerosis and ischemic heart disease. You may get questions in theory also. Any small topic can be asked at this point. Atherosclerosis and ischemic heart disease. What is atherosclerosis? The definition of atherosclerosis you can note down, or it's given in all books. Atherosclerosis is a progressive inflammatory disease of the artery. It is a progressive inflammatory disease of an artery. It's given in all books. You try to understand this. It's a progressive inflammatory disease of the arterial wall that is characterized by focal lipid-rich deposits. Focal lipid-rich deposits or atheroma. It's called as atheroma. That remain silent until they become large enough to impair the tissue perfusion. I will explain you everything, don't worry. Or until it ulcerates or ruptures and forms a thrombi or a distal embolization. This is a big definition. In short, atherosclerosis is nothing but it is a kind of arterial. This should be you should not misunderstand these two terminologies. I'll explain you on the whiteboard once the power comes. I'll explain you. We have two things here: atherosclerosis and arteriosclerosis. Arteriosclerosis is the entire arteries involved, which is age-related hardening of the vessels. Age-related hardening of the vessels. That is called arteriosclerosis. Atherosclerosis is a little different, but you can also take it as a type of arteriosclerosis. In atherosclerosis, we have local atheroma formation, local lipid deposition, local cholesterol deposition, especially the low density lipoprotein, LDL cholesterol deposits. So that is the difference. I'll draw the picture after some time and show you. You should not. You can sometimes use these two terms in an interchangeable way, but they are little different from each other. So today we are talking about atherosclerosis. Atherosclerosis means the lumen gets slowly occluded by a very slow process called atherosclerosis, which I told you last week. It takes some years to form. Atherosclerosis takes years to form. When we were discussing stroke, we were discussing how atherosclerosis forms. So the atherosclerosis can affect any artery practically in the body. Any artery can get any artery. Commonly, coronary arteries are common in this order. Coronary arteries, the cerebrovascular arteries, the peripheral arteries, limb arteries. Coronary arteries, the cerebral arteries, limb arteries, and then renal arteries. So these are any artery can get involved, but these are the common arteries that are involved. So as I said, it's a chronic progressive inflammation with deposition of fat inside the lumen. Thus, slowly the lumen size gets compromised. Thus, the circulation also slowly gets compromised. That is called atherosclerosis. It is an age-related disease, or there are some risk factor which accelerates this atherosclerosis, like your diabetes. So, what is the mechanism? Why does the blood becomes the blood vessel become atherosclerotic? What is the mechanism? Mechanism is there are many risk factors. Actually, if you take the mechanism, all these arteries they are vulnerable for damage inside because the blood is circulating. Because the speed of the blood, the artery, the intima, every minute, every second, there is billions of damages in the vessel that gets repaired by itself. But when atherosclerosis, when the repair does not take place properly or the inflammation predominates, you get atherosclerotic plaque. When a smooth intima artery, you know the three layers: intima, media, and adventitia. Intima, media, and adventitia. Intima is a single layer, actually very thin layer. When gets damaged, you get the deposition of this lipid cholesterol, and it will form over a period of time. It accumulates to form occlude the arterial compromise the lumen and compromise the tissue perfusion that this particular artery is supplying. Okay. So whenever there is damage, why should there be damage? The damage is a common procedure, common thing, because of the circulating blood, especially when somebody's BP is high because of pressure. This is shear stress. This is shear stress on the walls, intima of the artery. Especially the vulnerable areas are arterial bifurcation. Wherever your artery is bifurcating, or wherever your artery is branching in with an angle. So these are the anatomical locations which are vulnerable to the formation of atherosclerosis. The bifurcation or origin of the vessels, like aortic arch. In aortic arch, you have carotid, common carotid originating from the aortic arch. Origin of the vessel, bifurcation of the vessel, the branching with an angle. So there's some branches which branch at an acute angle. So these are the vulnerable places where, because of the pressure of the blood, the shear stress on the intima, you get a damage of the intimal layer. So when there is intimal layer damage, what happens? This is inflammation. Damage means inflammation. Inflammation occurs, traumatic inflammation. It begins with the trauma, and then the inflammatory cascade will get started. So what happens? The macrophages that are very good macrophages are macrocytes. Initially they are macrocytes, they become macrophages. The macrocytes go there, try to repair. That is the anti-inflammatory process that we already have inbuilt in our body. The anti-inflammatory process is a repair process. The microcytes go there and they try to sort of repair. And when they enter the intima, they go inside the media, intima, and then they release while they get activated because they have to throw the inflammatory mediators and anti-inflammatory. There is a war between inflammatory and anti-inflammatory mediators. They release the macrocytes. They release cytokines and other things. So these cytokines and the inflammatory mediators, they cause the inflammatory reaction, and then slowly it gets slowly attracted in. They stimulate because so many factors are released from the cell, and the middle layer, the muscle, smooth muscle also try to get inside in the process of repair. The smooth muscle proliferation also. In the meantime, the chemicals that are released, they also attract the other molecules like your LDL particles. LDL particles are small particles, small dense particles. The denser of the particle, the danger of the lipids. So they also go inside and get deposited. This is the beginning of the process. This is called the fatty streaks. They are seen as a fatty streak. There is no compromise of the lumen now in the beginning. And this process of atherosclerosis begins, as I told you, from the intrauterine life. The process of atherosclerosis begins from the intrauterine life. But who will develop real disease is the luck. So if there are additional insults like hypertension, diabetes, smoking, hyperlipidemia, the process gets accelerated. So the atherosclerotic process, the fatty streaks, yellow color streaks begin during the intrauterine life. So slowly from there, it goes on accumulating over a period of few decades. It can take 20, 30, 40, 50 years for the plaque to become big enough to compromise the lumen.